On this video, I'm going to be going over sectional matrices for class 2 fillings, posterior teeth. What we use is a sectional matrix. It's this little silver device here. If I can try to get that in the camera. And you'll notice that there is a curve to it. Of course, there's a curve that shapes the wall, but then there's also a convex and a concave surface. So here's the convex part, here's the concave. When we put ours in, we want the convex part, or the part that bows out, we want that to go down below the gum line when we put that in. A quick point before I do put these in, when they ship these, many times these little pieces, they kind of spoon each other, and they can deceive you, and you can actually get this in. They can usually be stuck pretty tight, and then once you get it in, you realize you've got two thicknesses, and that's not going to work. So when you get these, a little trick that we've learned is just take it and throw it down just to verify that it is just one and not two different matrices. So now that you know that it's a single matrices, again, we're going to put the convex surface down underneath the gum line. So we're going to insert that like this. Of course, on a model, it's much easier than when you're working in someone's mouth. So sometimes when you have to get into a tricky spot, wow, I've got multiple ones there, you have to take and do a little dog ear on it in order to get the position, because the patient's cheek might be in the way. So here we'll demonstrate. You're going to just bend this corner like this, and now you can put it in much easier. They do have special forceps for that, but if you want to do it this way and not add one more instrument, you can just do a little dog ear. And so you put that in, just kind of use your finger to press it into place, and so that when they're in, it looks kind of like that. Now, a common mistake is when you're inserting those is that you don't actually get them all the way underneath the gum line. They can get hung up on the interproximal box, down there, that lower part of the prep down there. It can get, that edge may get stuck. You may think you're down there, but you really aren't. In order for this to work right, it has to slide all the way down to the gum line, at least extend beyond the prepped box. Next, we're going to take a wedge. We call them points in our office, just because we were talking about this in front of patients. It's kinder to say a point as opposed to a wedge. I guess someone doesn't like the idea of a wedge going into their teeth or gums. So we're going to take this, and you'll see the kind of shape of it like that. I'm going to put this end down by the gum line. So let's go ahead and slide that in, and you have to hold it in place. And then we'll do the same thing over here. Make sure I get the orientation correct. Let me spin it. There. Okay. So now I'm going to go and slide that. And you always have to kind of hold these in place when you put them in. It's another problem you can run into. As you're sliding this into position, pushing from the buccal, you can come in from the lingual, but most of the time you come in from the buccal, is that this matrices will slide along with it. So you got to keep your finger on top of it while you're placing it in. Okay, so now that they're both in, it's time to put on our bitine rings. It's going to help keep these in place. Also, it's going to help spread these teeth slightly apart so that it makes up for the thickness of the interproximal sectional matrix. Okay, so we have two kinds. We have a long and a short. You can look at the tines. This is a short one. That's a long one. So in order for these to fit on when you're doing an MOD, you have to put the short one in first, and then you can put the long one in over it, so that they will fit together. So let's put the short one in first. And again, these are bitine ring, or we call them ring forceps. This is not a rubber dam forceps. They look very similar, but the tip is a little bit different on this. So we're going to take and place this in place, and you can put it either between the matrix and the wooden point, or the wedge, or you can put it on the other side. I prefer to put it, whenever I can, between the actual wedge and the interproximal sectional matrix. Because then what this bitine ring does, it kind of helps seal off that wall a little bit tighter on the inside. If you put it in the wedge, it will still work okay. If the patient's cheek or tongue is not cooperating, then that's fine. You can go on the other side. But what you don't want to do is, you don't want to have the tip of this ring, of this ring, you don't want that sitting on top of the the matrix. You want to, I'm sorry, on top of the point. You want to have it sliding out or sliding down underneath it. So let me try to get that closer to the camera. So that's where you want it. Okay. Next one, put in, this is the long one. Long goes over short. Also, this has a locking mechanism on it. So when you put this in, this little thing can slide. And now look, it stays. So it won't fall out. Once you disengage it, of course, now it will fall. All right, so we put this in. This is good for assistance when they hand this to the doctor. It can all be put together and it can transfer without the loss of this coming off. Okay, again, we're going to slide this over. Make sure it's either going to go in front of or behind the wooden point, but just not sit on top of it. And then, of course, if you have that locking mechanism, you got to make sure it comes loose. And let's check that out. Okay, that looks right. That's the way it should be set up. Short goes in first, long goes in over the top of it, and that would be set up for an MOD. If you're just doing an MO or just a DO, you can either use the short or the long. It doesn't matter. It's kind of the doctor's preference on which way they want to go. But that is how you set up a sectional interproximal matrix system. And when you go to take it apart, same kind of thing. You're going to just go in reverse order, take this off to the side, disengage it. Same thing over here, take that off. And then slide this out, slide this out. And here's an important clinical feature. When you're taking this point out, a lot of times it's going to be so tightly packed in there that just most of the time this instrument won't work. Many times you're going to need is a hemostat instead. The hemostat will allow you to take and grip this corner, grip, and I'm locking it right there. And now when I go to pull it out, I've got more grippage on it. Now a key point is when you're taking this out, this is a wrist movement. This is not an elbow movement. Imagine you still have a patient's cheek is right here. If you are pulling and pulling and all of a sudden it breaks free and you're really using your whole arm, you could pull and slip and cut the patient's lip with this very sharp edge. So keep in mind, this is just a wrist movement. Remember, protect the patient as you're removing this sectional matrix. And then you go do the same thing over here. And that would be it. That's how you assemble and disassemble. Oh, important point. When we get finished, you notice there's a dent right here on that matrix. Not that you would ever reuse this, but if you had a problem putting one of these in and you had to take it out and then try to reinsert this on the same patient, if it already has a dent, throw it out. Just get a brand new one. It's not going to be worth it to try to burnish out that bubble that's in there. Just get rid of it and start with a whole brand new one. Okay, so that is interproximal sectional matrices. Another point about interproximal matrices, sectional matrices, are the different shapes. We're going to use primarily this one. They do make ones a little bit smaller we can use for premolars, but most of the time we're going to use these. However, there are situations where the prep, like say in the mesial or the distal, goes really far down subgingivally almost, and this just doesn't reach. Even when you get it past, down to the gum line, you start sliding it underneath the gum line, it still may not reach that complete extent of where we need to seal off. And so they do make this thing. It's from Garrison Dental, and it has a small little extender tab on it right there. And you can see how that would allow that extra little reach as we put this in. Let's imagine this was a very deep distal prep. We could slide this in, and once it gets around there, you can tell that would have just a little bit more coverage gingivally as we put that in place. And of course, we would put in our point right there, our wedge, and then that would help seal that off. But we only use this maybe 5% of the time, because if the prep is that deep, it's probably going to need something else besides just filling. But we even use this at times when we're doing buildups, when they go pretty deep. But just know that is one extra little trick or something we have in our toolbox to help fix some of these problems. Okay, we call this one the Garrison one with the extender tab.